I'm 10 years old. I'm going to read, I think, the side effects of a drug called Daytriana.
The drug Adderall.
Luvox.
Cymbalta.
Gyudon. Lexapro.
Namenda.
I have a question.
Where do I find the side effects?
How do I read it if it's too small?
Just a bunch of letters squished together.
I can't read this. This is the side effects of the drug.
Side effects. Stroke.
Gastra, what the heck?
Speech disorder.
Eye disorders, vision blurred.
Dry mouth. Nervous.
Tremor, dizziness, delirium, and coma.
Tardive dyskinesia.
They experience worsening of their depression.
Aggressive reaction.
Paranoid reaction.
Psychosis.
Serious cardiovascular events.
Other serious heart problems.
Heart failure.
What? Suicidal thoughts.
Suicidal thinking and behavior.
Increases the risk of suicide.
An increased risk of death.
Sudden death.
These guys must be kidding.
Wow.
This is gross.
Seeing this on a warning label, does anybody have any clue what they're putting their kids into?
This isn't good.
No drug has side effects. They're all effects. Side effect is just a way that doctors explain away the effects that they don't like or you won't like, but they're effects.
These are the effects of these drugs. They're not just what might happen to you, they're what happen more often than not.
We name them side effects because they're an unintended consequence.
The antidepressant drugs not only don't make you happy, they have all kinds of negative effects on the system as a whole.
These drugs are absorbed and distributed throughout your entire body, so they have side effects through all of your tissues and organs, including your liver and your kidneys and your nervous system.
They destroy the brain, the neural net. They literally kill brain cells and cause all kinds of brain disorders. That's why we have they're not side effects, they're direct effects.
But while psychiatrists continually downplay the multitude of severe health risks to the public, candidly, they had no problem admitting them to our cameras.
I think I tell them the main side effects. I don't tell them every side effect because there are so many possible side effects.
I would say the majority of patients experience some side effects.
People get side effects to every medication you try.
They all have side effects.
All kinds of side effects. Lots of side effects. Physical feelings of sickness.
Headaches, insomnia.
They can't sleep. They can't eat.
Drowsiness. Sedation is very frequent.
Restlessness. Appetite stimulation.
Neurologic side effects.
Tremor or muscle spasms.
Stiffness. Weight gain.
Obesity.
Weight gain and stuff like that.
Decreased performance of sexual functioning. Sexual side effects can happen.
Sexual dysfunction, etc.
I've never had anybody die or anything, but I've had people faint and stuff, and it's really sort of unpredictable.
You name it, and it can be a side effect.
And why can't psychiatrists predict what adverse reactions you will get? Because not one of them knows how their drugs work.
At least with street drugs, people know that they're dangerous, that they should be off of them. With pharmaceuticals, people are told they're safe to take every day.
But far from being safe, psychotropic drugs are increasingly being exposed as chemical toxins with the power to kill.
Some of the side effects that have become of concern lately are suicide, increased risk of suicide, increased risk of homicide.
These aren't people that were horribly depressed when they were given a drug. These are people who are given a drug for social anxiety or difficulty sleeping or mild depression and then become suicidal. And so when they become suicidal and they kill themselves, what the doctor does is go back and say, oh, well, it's because they were depressed.
The label itself, the disorder, is what is blamed for the side effects. When in reality, it's the drug that is causing the side effect. It is the drug that is the problem.
Drugs such as the antidepressant prescribed to Woody Witzak, who took it not for any mental complaint, but to help him sleep.
My husband and I, Tim, his nickname Woody, we were married just 2 months shy of 10 years, so we've had a long life together. And Woody was a guy who was healthy. He was a big runner. He's never had a history of depression or any other so-called mental illness. He was given Zoloft for insomnia. I find Woody one night completely sweat through his shirt in fetal position, kept going, Kim, you gotta help me, I don't know what's happening to me. It's like my head's outside my body looking in. Kim, help me, help me. We did breathing, listened to music, prayed, anything to calm him down from this head outside his body feeling. And a week later, he was found dead, hanging. A guy who loved life.
Psychiatrists claim their drugs save lives, but according to their own studies, psychotropic drugs double the risk of suicide, with one increasing the risk by a factor of almost 7.
As a pharmacist who has been studying the problem for the past 7 years, I do see a glaring connection between the high use of these psychoactive substances and the rise of violence.
If people knew that the mechanism was not known of these drugs, that they could cause, if there's a real chance for them to get a homicidal tendency or even suicide, if you take the drug, there's a chance you may want to kill yourself.
And I could repeat probably a dozen other examples of significant self-inflicted harm or significant violence to others in patients who had never had that experience in their adult life.
Patients such as Wyoming grandfather Donald Shell.
Donald Shell was a man in his 60s, a gentleman, a family man, a funny man. He had had periodic episodes of depression, but never any real serious mental health issues, and became depressed, had a down period, went to a general practitioner and was given Paxil. 2 days later, he shot his wife, his daughter, his 9-month-old granddaughter, and then himself. The first question the jury was asked, very telling question, can Paxil cause some people to commit homicide and or suicide? To which they answered yes.
Donald Shell was on Paxil for only days before his murderous drug reaction. But long-term use of psychotropics has also proven to create a lifetime of damage, an unwelcome fact ignored by psychiatrists.
In the long run, the side effects may actually be worse than the original condition.
I don't think the average patient has any idea that the long-term use of this drug is now associated with very serious diseases, with diabetes, with kidney failure, with tardive dyskinesia, a movement disorder that's very serious and permanent and irreversible.
You can be affected by these drugs in any part of your body, your brain, your heart, your kidneys.
That's why people die early very often, because they are prescribed things, and the long-term effects are, in some cases, the death of the individual.
And more damage is created by polypharmacy, where psychiatrists make a fat living prescribing multiple psychiatric drugs, one to offset the effects of another.
If you have drugs that create side effects, that gives you a ready market for more drugs to cure the side effects. It seems to me that it's a self-propagating system.
And what ends up happening is that each one of those new drugs that's added into the scenario brings on another symptom for which there's another drug, for which there's another symptom, for which there's another drug.
And it just snowballs into a vicious circle of one drug causing the need for another drug.
Sometimes people come and they're on such a cocktail of so many different drugs for so many different things.
It's rare now that I see a senior citizen that is on less than 5 or 6 drugs at one time. Some 12, 15.
One will lead to the next, and they're all toxic. This is how the game is played.
And as psychiatrists spread their lucrative game of psychotropic drugging further and further into society, children have become the latest and most tragic of casualties.
Rebecca Riley, 2.5 years old, they diagnosed her with bipolar disorder and ADHD. They had her on an antipsychotic, they had her on a heart drug, they say, for ADHD, and they had her on an anti-seizure. And then one other one for side effects. 4 drugs at 2.5 years old. She can't even zip up her own pants. She's like a little rag doll. The school nurse, 2 teachers, the principal, the social worker, all said they never seen any behavior in this little 4-year-old girl that would warrant these kind of medications. And all specifically called this doctor and said please take her off these. She died at a little over 4 years old. This little girl that didn't have a chance, and the psychiatrist just let her.
Instead of standing trial and facing prison time, Rebecca Riley's psychiatrist, Dr. Keiko Kifuji, hasn't even lost her license. One might well ask how psychiatrists get away with it. The answer lies in a legal concept known as standard of care.
The standard of care is based on what do other doctors do? What would a reasonable physician do in this situation? And the reality is that what most physicians do is prescribe medications.
As long as they've done their paperwork properly and documented that this child had the symptoms that led them to this conclusion, they appear to be completely protected from any kind of a lawsuit as a result.
The standard of care is what allows doctors to seriously injure or even kill a patient with total impunity.
So the standard of care now has been implemented to where you can get away with, if you're a medical doctor, psychiatrist, you can get away with murder.
And the death count keeps rising. Psychotropic drugs now kill an estimated 42,000 people every year.
The cost to society is very real and very devastating. But the medicine they're practicing isn't real. It's a hoax.
Profit always comes before patient safety, and they take a very short-sighted view. It's all about how can we make money today, not what price are we going to pay tomorrow.
The trail of destruction that a psychiatrist leaves in his path is of no concern to that guy. It's all about money.
And the money is big. Psychiatry is today over a $300 billion industry without a single cure. And as more and more breakthroughs are promised by psychiatrists, their running total of sick, injured, and dead victims continues to escalate. Unprotected, it is the public, you, who must fend for themselves.
My wife and I are blessed. We have 7 children, and we love them all. They're all our favorites. Each child we have is our favorites. And Beth was extremely special.
She was kind, generous. She had like a really sweet and caring personality.
She had this beautiful smile, like an inviting.
She could make friends with basically any stranger on the street and get a smile or a laugh out of them.
Beth was having a hard time sleeping for maybe 4, 5, or 6 weeks. And so we said, Beth, you should go to the doctor and get something to help you sleep.
He said, okay, well, I'll try to give you something to lessen your anxiety, and it should help you sleep.
Within 5 minutes, a 5-minute visit, he prescribed her Paxil. When I first saw Beth right after she went on the Paxil, she was different. Like, I felt like she was drugged. And by the 2nd or 3rd day, she's like, I don't know, I just don't feel right. You know, I feel strange in my skin.
But after about 3 or 4 days, I remember that Beth was, at times, very different, like sullen, keeping to herself.
My mom and her were having dinner, and she said she didn't have any real emotion. Like, she kind of felt emotionally numb.
She was like a different person. Like, she just seemed like she was under the influence of something. She didn't seem like herself. She seemed like she was tripping out.
I talked to her on the phone, and she told me she didn't want to be there. And I was like, why don't you be there? She's like, I just don't feel like myself. I just feel like crazy. I just don't feel right.
I truly believe that she was hallucinating maybe and going in and out of this psychotic state at this point.
It seemed like she was melting down, like emotionally. She was becoming worse every day.
I said, are you suicidal? I actually asked her. And she laughed at me. And she said, no, I would never do that. I'm thinking in my mind, I'm just going to lay down next to her and I'll rub her head and I'll talk to her and we'll try to figure out what we're going to do because something's not right here. And my son Matthew was right behind me going upstairs. And when I got to the top of the stairs, I saw her hanging in the hallway.
Then the police were all over the place and people were coming and going, and about 3 hours, 4 hours after my daughter died, one of my friends came over and said, you know, I was speaking to so-and-so, one of our other friends, and she said, oh, Beth must have been on Paxil. That's the only way she would kill herself.
It just wasn't her. There was nothing in her that would have done that. She was the most non-violent, like gentle. It's a violent way to die.
It had to be the drug. There was no other answer. If we knew what we knew now, Beth would be here with us today. I know that for a fact.
The tragic story of Beth Winter is just one of many. A tale repeated wherever psychiatric drugs are prescribed. But psychiatrists insist you believe that their drugs are safe and effective because they are the mental health experts and you are not. But case after case proves that trusting them can have disastrous consequences.
Psychiatry is pseudoscience. It's false science. It cannot withstand rigorous review if people would just look at the evidence.
If they help anyone, it's not worth the risk to the people that are harmed by them.
They are betraying every customer they have.
They don't know what they're doing, and we need to educate the public to use their feet and walk away.
And how can the public become more educated? By exercising a central medical right, little known to the patient, but very familiar to psychiatrists.
We want to be able to present the patient with alternatives. And one of the central ideas in ethics is informed consent.
The components of informed consent are letting the person know, first of all, what the diagnosis is and what it's based on so that they can say, this is why we need to treat you. And secondly, what the treatment is.
Every patient in the healthcare system has a right to informed consent. That is, they have a right to be told the risks and benefits of the treatment, the risks and benefits of alternative treatments, and the risks and benefits of no treatment at all.
Patients should be totally informed, fully informed about every medication that the psychiatrist offers to them to take or says they should take.
And studies confirm that very little full and accurate information about psychiatric drugs is getting through to the public. So what would full and accurate, informed consent on psychiatric drugs consist of? These medical doctors and experts have extensive experience in the subject. Their first point, psychiatric disorders are not actual diseases requiring medical treatment.
It's true that there's no biological findings that really support any of these psychiatric diagnoses being medical illnesses. And the burden of proof really is the other way around. It's not that you have to prove that there is no biological science. The burden is on psychiatry to prove that there is.
There's no blood test. There's no lab test. There's no x-ray. These are just clusters of behavior that a group of psychiatrists have voted that it's a disease.
Can you imagine doctors having to have powwows to decide if a heart attack is a real disease or not? No, they don't have to decide that. They don't have to have a vote on that.
They should be asking the doc, geez doc, where's the chemical test for that? Where is the objective test for this? And I guarantee you that they'll be told, we don't have a chemical test for that.
There is no such thing as a chemical imbalance. And any psychiatrist that you talk to, if you ask him this question, they'll all admit it in private, but they won't admit it in public. It's a scandal.
So this is all subjective. Nothing objective about psychiatry.
2, there is no scientific proof that psychotropic drugs resolve any mental problems.
Since there is no measurement for these psychiatric diagnoses, because they're really just subjective, for the same reason there really can't be a measurement for the effects of the drug.
In terms of medication, the evidence that's claimed is the medications are highly effective and not very toxic. But actually, in fact, the data in psychiatry are very clear that that's not true. What is true is that the medications are barely, if at all, more effective than placebo.
You're selling drugs to people under false premises, under a disease that's been invented. So how do you measure efficacy among a disease that doesn't even exist?
3, psychotropic drugs mask symptoms and come with severe short and long-term side effects.
Whatever problem you're being treated for, whether it's depression, real or otherwise, or cardiovascular disease. Medicating away the symptoms is not solving the problem.
The patent medication gives the appearance of having helped because in the short term, it usually doesn't show the bad effects that are going to happen in the long term. So it's very deceptive.
The longer the patient's on the medication, the worse the prognosis is.
None of these medications hit precise targets. You begin accumulating all kinds of collateral damage. In other words, other organs in the body are actually harmed.
So for the first time, we're seeing kids in grade school or middle school who have type 2 diabetes and who have the beginning stages of cardiovascular disease.
So you see Parkinson's disease, you see tardive dyskinesias, you see other movement disorders.
Is it true that we're now seeing a lot of death from psychiatric drugs? Absolutely yes.
4. Psychotropic drugs can cause dependency and addiction.
One of the hallmarks of informed consent with psychiatric meds is you have to discuss the potential for addiction.
The vast majority of psychiatric drugs create psychological and physical dependency.
Most patients that I've seen that were on these drugs have difficulty getting off of them. It's rare for somebody to just be able to stop it without a problem.
5. Most mental problems are caused by an underlying physical illness.
Many physical conditions can cause mental problems or what pose as psychiatric symptoms, but the psychiatrist, in the records I've reviewed, psychiatrist does not do an in-depth study of what could be causing the problem.
And if the doctor isn't taking the time to find the cause of those symptoms, then unfortunately those symptoms may continue and there may be a serious underlying medical disorder that's being overlooked.
The question is it better to treat depression with a drug, or is it better to treat depression by trying to figure out what caused the depression and working it out with the patient?
Dehydration can make you exhibit symptoms of depression. Sleeplessness can make you exhibit symptoms of depression. Eating a terrible diet, hypoglycemia, being sedentary, all of these things are biological reasons for having symptoms of depression.
I have in my practice children who are misdiagnosed as having ADD, ADHD, who really have Lyme disease.
70% of all what are classified as mental illnesses actually have a physical cause, a physical problem causing that.
6. No matter how severe the emotional or psychological distress, there are many effective options that do not involve psychotropic drugs.
Once you've proven that there is no problem in the body and that there is no malfunction in the brain, then you have to begin to address these other levels of the self. And I think that's what psychiatry has completely stopped doing.
There are very few conditions that cannot be treated by other methods than the use of drugs.
Any forces that impinge on medicine that make us think that the drug approach is the only approach is undermining good patient care.
And because most non-drug options are rarely told to patients, true informed consent is almost never given.
When you get into informed consent, it's almost a responsibility of the patient to make an inquiry about the hazards of the drug and not rely on what the psychiatrist or physician tells them.
We can't go in and abdicate our responsibility as consumers simply because somebody has an MD after their name or someone is a psychiatrist and we think they know more than we do.
The best way to protect yourself is to educate yourself, is to ask questions not only of your doctor, but to do your own research.
Don't be ignorant, be informed. Get information from as many places as you can. That's how you'll be an intelligent, skeptical consumer, and that's how you will protect the safety of yourself, your children, and your entire family from this industry of death known as modern psychiatry.
And as modern psychiatry has permeated our world over the last 50 years, so too has psychotropic drugging. But there is a way to expose this medical abuse. By reporting all complaints and adverse psychiatric drug reactions to your National Drug Regulatory Agency. MedWatch is the federal reporting program in the United States.
MedWatch is a voluntary reporting system, a passive reporting system where doctors, patients, healthcare providers, pharmacists, anybody really can make a report saying that they think that what they experienced or what their patient experienced was an adverse drug effect.
And this is what we call post-marketing surveillance. And this begins to get a look at what the side effects of long-term or chronic use of these drugs really is.
The FDA admits that probably only 1% of all the adverse drug effects are actually reported by patients or physicians.
It is only through the reporting of all adverse drug reactions that the true scale of the horrors of psychotropic drugging will come to light. You have the facts. Share this video with your doctor, and don't allow yourself, your friends, or your loved ones to become the next statistic of the big business of psychotropic drugging. To find out more about psychiatry and psychotropic drugging, or to report a case of psychiatric abuse, contact the Citizens Commission on Human Rights.